Hi, I'm Dawn Salmons, and today, as part of the Medical Dermatology Pearls, I touched on using painless PDT in your practice, which essentially is a regimen where you utilize no incubation and you extend your illumination, whether you're using blue light or red light, anywhere from, let's say, 30 minutes to 45 minutes to get a really robust outcome without any patient perceived pain. So something you can absolutely add to your practice.
And I'm Jocelyn Kirby. I have some tips on hidradenitis suppurativa. First one is when you're thinking about infliximab, and I use it frequently as a second or third line therapy, is go big or go home with the dose. So starting at 10 milligrams per kilogram, usual induction of 0, 2, and 6 weeks with maintenance every 4 to 6 weeks. After that, keeping in mind that biosimilars are coming to dermatology, so far no data to show that the different types of infliximab make a big difference, but there are some early studies showing maybe some differences for the biosimilar adalimumab, but we need a little more work there. My approach is going to be I'm going to take what insurance can give me right off the bat, but if it's not working, I might switch to branded. And then the third take home is with wound care. Wound care can help with pain, with drainage, with a lot of the discomfort that people have. Go with alginates or fiber dressings, and then I like a border, so you don't need extra tape. It's usually built into the dressing, and something with a silicone base. So Sorbion sachets, Fluazorb are a couple of the brands, but again, I take what insurance can give me.
Hi, I'm Bonnie Aluski at the University of Alabama, Birmingham, Alabama. And my talk this morning was on using oral minoxidil in patients with hair loss or alopecia. I use it predominantly for patients with female pattern or male pattern alopecia, but I use it for all sorts of alopecia. I generally start with 1/4 of a 2.5 milligram tablet for ladies, which is 0.625 milligrams, and 1/2 of a tablet or 1.25 milligrams for men. Now, the reason I selected this dose was because if you use the topical solution, the 5% solution has 50 milligrams of minoxidil per ml. So if you apply that ml twice a day as per indicated in the package insert, you're applying 100 milligrams of minoxidil to your head. 1.4% is absorbed, so roughly 1.4 milligrams is absorbed, and that's the dose for men. So you can get close to that dose by half a tablet or 1.25 milligrams. The women's dose is half that, or roughly a 1/4 tablet a day. So I feel that's a good way to start, and then you can work your way up if needed. However, minoxidil is not utterly harmless. You can get unwanted facial hair, you can get edema. When possible, it's good to give spironolactone with it, even if it's only 25 milligrams of spironolactone with it to prevent edema. And it is contraindicated in patients who've had a recent MI, who have liver disease, liver failure, renal failure, and certain other cardiac problems. But it's a great drug, and it's great for our patients with alopecia.
Hi, I'm David Pariser. I have 3 clinical tips for you that I presented at my session today. The first regards the use of lidocaine. We're having shortages of lidocaine, and some people have been using veterinary lidocaine. Please don't do that. It's illegal. You can be fined, you can lose your medical license, and you can be sued. If you have trouble finding it through your regular sources, try dental lidocaine, which is much more easily available. My second tip regards the treatment of palmar hyperhidrosis, excessive sweating of the hands, with the use of the glycopyrronium cloth, currently approved for treatment of underarm axillary hyperhidrosis. You can use it on the hands by applying it, by rubbing until it dries, putting your hands in unoccluded cotton gloves for 30 minutes, take it off, and wash your hands after that. Third tip involves getting involved in clinical trials. It'll add a great dimension to your practice. Talk to your pharmaceutical representatives about the possibility of working that into your practice.